Okay, ladies and gentlemen, good day all, and you are welcome to my YouTube channel. So in this video, we are going to look at the concept of malaria RDT test. Don't forget to subscribe and follow my YouTube channel for more videos. Introduction to malaria RDT tests. Malaria Rapid Diagnostic Test. The RDT stand for Rapid Diagnostic Tests. Are quick, simple tools used to detect malaria infections. So we said malaria RDT test is one of the simplest and the easiest way to conduct or to detect malaria infections. So sometimes actually if you have a patient and you wanted to diagnose malaria, so the best way is to use RDT because it is very quick and simple, and also at the same time it doesn't require any sophisticated equipment. The RDT malaria test usually produce or provide test result within 15 to 20 minutes, facilitating prompt treatment decisions. So actually for RDT test, it can give you your result within 15 to 20 minutes, and that can actually facilitate treatment decision. The RDT tests are especially useful in areas with limited laboratory infrastructure and skilled personnel. So if you're actually living in an area where there is no laboratory infrastructure as well as skilled personnel, so it is actually very important to apply RDT test because it is easier, it is quick, and it doesn't require any sophisticated equipment. So these are actually the different components of the RDT test. As we can clearly see, it is made up of the round hole where we add buffer. As we can see it clearly, this is the round hole where we add buffer, and this is a square hole, and this is where we add blood. And then of course we have result window. So this is the result window as we can see. And then in the result window, we have the control line, and then we have test line. So these are actually the basic components for RDT test. We have a square hole. So in the square hole, that is where we add blood. And then of course the round hole, that is where we add buffer. So how malaria RDT work? RDTs detect specific antigen produced by malaria parasite in a person's blood. So actually, ladies and gentlemen, there are some antigens or proteins that are produced by these malaria parasites during infections. So RDT, it's actually the specific antigens produced by the malaria parasite that is detected. And some of these common antigens that are produced by the parasite or by the malaria parasite during the malaria parasite infection are histidine-rich protein 2, and then also Plasmodium lactate dehydrogenase. So these are the proteins or specific antigens that are produced by malaria parasites during infections. And it is these antigens or these proteins that are detected by the RDT kits. So as we can see, ladies and gentlemen, this is actually, of course, I think if you could remember, at the first stage, we talk about that, of course, part of the component of the RDT kits is made of a square hole and then also a round hole. So in the square hole, that is where we add blood. And then, of course, in the round hole, that is where we add buffer. So the major functions of adding, or the major reason why we add buffer, it serves as a flushing agent. That is, after you add the blood, then you add the buffer, then the buffer will now flush the blood so that it can move to the oval window. That is where the reading of the malaria parasites would be detected. So of course, as we can see in the RDT kit, it is coated with an antigen, and it is this antigen that interact or antibody. It is, of course, as we can see, the malaria antigen, which is AG, is captured by label antibody. So it means that in the RDT kit, there is antibodies that is immobilized or labeled on the kit, which captured or detect the proteins or the specific antigens that are produced by the malaria parasite. So these specific antigen or produced that are produced by the malaria parasite are histidine-rich protein 2 and plasmodium lactate dehydrogenase. So these are the proteins that interact with the label antibodies on the test kits. So, and as you can see, this is the blood and the label antibody flush along the strip using a fluorescein agent, which is the buffer. So as we can see, a sample of blood is applied to the test strip. So as we can see, this is where you now apply a sample of blood to the test strip, and then which produce a visible lines indicating positive or negative results. So we are going to look at how you can even collect the blood. So after collecting the blood, then how you apply the blood, and then how you also apply the buffer for the pollution. So of course, ladies and gentlemen, we have different types of malaria RDT test. So we have there are single species tests that detect only one type of malaria parasite, such as Plasmodium falciparum. So there are different test kits. There are malaria RDTs that detect only one species of the malaria parasite. And of course, we have different species of malaria parasite, which include Plasmodium falciparum, Plasmodium vivax, Plasmodium noelisi, Plasmodium ovale, Plasmodium malariae. We have different species of malaria parasites. So we have some test strip or some RDT that detect only one specific type of parasites. Then we also have multi-species test, which can identify multiple species in a single test. So the choice of the test depends on the local malaria epidemiology and a specific diagnostic needs. So for example, if you are actually targeting only Plasmodium falciparum, then you can use a single species RDT kit. And if you want to detect multiple species, then you can use the multiple tests or multiple RDT test kits. But of course, as we can see, it depends on the epidemiology, that is the local epidemiology that is based on the prevalence of the malaria parasite in the area. If it is known that, of course, in the area, the have only Plasmodium falciparum, then it means that you need to go for only local, only single species test. Like for example, in Nigeria, most of the Plasmodium we have here is Plasmodium falciparum and vivax. So of course, you can actually use a multi-species test kits, which can actually, maybe you can use Plasmodium falciparum and Plasmodium vivax test kits that can detect both Plasmodium falciparum and Plasmodium vivax. So then RDT test procedure and test result. So actually the first thing to do, you need to prepare the site. You need to clean the patient's finger, ensure a clean puncture. So that is the first thing. You need to actually identify the finger that you want to collect your blood, and then you clean it up with alcohol swab. Then after you do that, then you perform the prick. How do you perform the prick? Then you use a lancet to prick the finger and then collecting a drop of blood. So after collecting a drop of blood, then you now add about 5 microliter or 2 drop of the blood, as you can see, into the square hole. And after you do that, then the next thing you add a flushing buffer. Then after you add the flushing buffer, you add like about 2 drops of the flushing buffer. to develop well. So after you do that, then you now read the result in 20 minutes. So how do you see your result? So you can have three results. Whenever you conducted RDT test, you can actually have three results. You can have positive, you can have negative, and you can have invalid. So how do you see positive? So you can see, as you could remember from the component of the RDT kits, we have a control line and we have a test line. So if you are able to have a two double line, one at the control and one at the test, it means that you have a positive. So as you can see, this is a positive result and this is also a negative result. Sorry, this is also a positive result. But what I want you to understand is that if you look at the two positive results, in the case of test line, you can see that for the first one, it is more visible than this one. The reason is because it tells you that in the first one, you have more malaria parasites. It means that you have a high density of the malaria parasite. And then, of course, it is going to be negative if you only have a line in the at the control line. So if you can see that you have the single line at the control line, so that tells you that it is a negative result. And it is invalid if there is no any control line. If at the control line, or if at the control line you didn't observe any line, it means that it is invalid. You see, at this point, no the control, it doesn't appear, and the test also, there is no line at both control line and the test line. But of course, for this one, you only have it at the test line without present at the control line. So it tells you that this is invalid. So what happens if you have invalid result? So you have to do the test again. You have to do it again. So this is actually RDT test and it has advantage. So advantage of RDT tests, RDT offer a rapid result, enabling immediate treatment initiation. And they require minimal training and no sophisticated laboratory equipment. And also at the same time, RDTs are highly portable, making them ideal for use in remote or limited resources settings or resources limited settings. So what I want you to understand, ladies and gentlemen, one of the advantage of the malaria RDT test, it's actually very rapid, it is quick, and it require minimal training and no sophisticated laboratory equipment is required, and then it is highly portable. What are the limitations? So RDT can produce false negative result, especially in cases of low parasite density. So if there is a low parasite density, there is a likelihood that it may give a false negative, or maybe absence or the deletion of histone-rich protein 2. So if there is a deletion of histone-rich protein 2, so it means that it is also going to give a false negative result. They might give false positive result due to persistent antigens after treatment. Yeah, of course, because after treatment, sometimes you may still have the antigens. So as a result of that, it may also give a false positive result. And then proper storage and handling are essential to maintain test accuracy, as high temperature and humidity can affect performance. So in conclusion, malaria RDT tests are vital tools in the fight against malaria, supporting timely diagnosis and treatment. So ongoing research aims to improve their sensitivity, specificity, and affordability. So integrating RDT into comprehensive malaria control programs can significantly reduce disease burden worldwide. And of course, as you can remember, we have also different types of malaria RDT tests. So the three main group of antigens detected by commercially available RDT kits include histidine-rich protein 2. So this is actually the antigen that used to that are detected or that is specific to Plasmodium, so which is soluble, highly stable antigens present abundantly in cytoplasm and membrane of affected erythrocytes. So these antigens is present in the cytoplasm and also the membrane of the affected red blood cells. And then the next one is also a parasite-specific lactate dehydrogenase Plasmodium, which is highly specific, and also fan-specific or vivax specific. And also there is aldolase, which is also fan-specific. It's conserved. There is a major enzymes in malaria and malarial glycolytic pathway. So these are actually the three different antigens that can be detected by the antibodies on the RDT kits. So ladies and gentlemen, this is where we are going to stop. Please don't forget to subscribe, follow, join, and subscribe to my YouTube channel.